What is up, our beautiful
Hey,
YouTube
guys.
gang? We are going into another informational video. This one is about who has the best healthcare. And I know,
Not us.
I know, yeah, we know it ain't up. We know that. But I'm curious to know because we only learned about like how UK offers, so I'm curious to know how everybody else functions too, and just how bad we're down the food train. But if you are new,
The food train?
the food train, chain. It's been a long, y'all.
It's been a long
2
day.
days for me.
Yeah.
And anyways, what I was about to say. Oh, other channels down below, guys. Hit that subscribe, like, notification bell. Let's dive in.
I want to start with a simple question. Which country in the world has the best healthcare system?
Yeah, so I hate that question. Here's where you should ask me why I hate that question.
Why?
I knew you were going to start with that question.
I think it's a question that a lot of people ask. Which country has the best healthcare system? And
I don't think there's a correct answer to it.
It depends on what it is that we value.
I'll give you an answer, but then I'll tell you why the answer might not be applicable. If you look at the world
Were we at the
health
bottom?
rankings, the country that came out on top is France.
I think we was all the way
I
at the
think
bottom.
in general, starting from France and working northern, you tend to get the best healthcare systems. But the reason why it's not entirely applicable is that what works in one country may not work in another country.
True.
So a number of years ago, just a few years ago, I wrote a piece in the New York Times with my colleague Aaron Carroll. We actually did a tournament of health systems. It was like a bracket tournament, the way March Madness is a bracket tournament, or like a tennis tournament.
United States did big.
And we had me and Aaron, Uwe Reinhardt, Ashish Shah, physician, now Dean of Brown, and Craig Garthwaite, an economist at Northwestern. And we each voted in each of the brackets, like in each of the pairings, for which system we liked better. And then like we ultimately got a winner. But one of the important takeaways from that whole process is that in no pairing did any country win 5-0. There were 5 of us, right? We were not unanimous in any decision. There was always at least someone who disagreed, and in many cases it was 3-2.
Oh, dang.
And we each had different reasons. You know, someone was very big on like the cost, equity, access, or the quality. And so to me, like, look, this is 5 people who know healthcare pretty well and know these systems pretty well, and we couldn't even agree. So there's just no clear winner, actually.
But the one thing that stands out is that among all major developed nations, it's pretty clear that the United States comes in dead last.
On the other hand, I think everyone, especially experts, should be skeptical that they know the answer. Because what works in one country or one setting doesn't necessarily work in another.
So, you know, there are aspects of the Australian system I like. There are aspects of the English system I like. But I don't think that there's a system we could just bring over here and install. Like,
Yeah, that's
But I
crazy.
feel like that's true also because I feel like I feel we are different, like the United States and Italy. I feel like that's 2 different places and stuff. You know, like I don't know how
I
to
never thought of
explain
it that way.
it. Like I'm trying to think of the way I'm trying.
Now that they brought it up
explain
on this video, I didn't think it'll be different. Like, there's different issues, different health issues.
Like you got to think in Italy.
I'm pretty sure we got the common core ones, but they
Yeah.
probably have like.
But I just feel like this could sound dumb, but I just feel like in Italy, like I feel like they eat a certain amount of like fruits and stuff like that. Like it's very like repetitive of, you know, being
All that
Italian and stuff. Then you come to the United States and it's like, oh, it's so many different cultures, so many different foods, process, everything. So I think also that helps with our health, and then comes with the health system, like as far as like what they offer. But I'm pretty sure they don't offer a lot because they know it's not much going to come into the hospital because they're not as sick or something, if that makes sense. Like I feel like I don't make sense, but I feel like that makes sense.
I just think it's just different. Like I said, I think we have the common health issues across the board, but they deal with like different animals, different foods, different. So their sicknesses might just be different from ours. That's what you said. I get what you're saying. That's what I mean. I'm trying to sum it up for you. You're looking at me like, oh, I just said that. I'm trying to sum it up in your words. But I think that's what it is. And I never processed, since we've been on the healthcare thing. I never thought like, oh yeah. I was just thinking like, ours suck, you know.
Yeah.
But it still does. It still does.
a new fridge.
So maybe the better question is, what would the best system for the US look like?
And what would that look like?
So a good healthcare system, or a good, let's just call it a healthcare system. A good healthcare system has, I think, to me, several attributes. One is,
how does it affect our health as a country?
How long is it that people are living? What is the infant mortality rate? What is the rate of certain types of diseases, and how well are they doing in prevention?
And the second question I'd want to know the answer to is, were the benefits of the treatment greater than the cost of the treatment?
Yeah.
A bad healthcare system could have overspending on care that's of really questionable health benefit at the same time that it has underspending on healthcare that's of vital importance to people. So when people say, do we spend too much on healthcare? We spend way too much on some things and way too little on others. So a good system would fix both problems.
And the third dimension for healthcare system is, how well does it reflect our values as a society?
And by values, I mean, what are the rich willing to do for the poor? What are the healthy willing to do for the sick? The answer to that doesn't come from economics. It's an answer that we all have within us. But that answer profoundly affects how you answer questions about what's good and bad about healthcare.
And I would hope that going forward, as we think about the learnings from other countries, we can take a hard look at what it is that we have and whether they align with our core principles that we otherwise hold so dear.
So my goal is have a health system that does the most it can to improve our health, that protects people from financial ruin, and that conforms to our values as a society.
So yeah, that would be the right thing to do in principle. The next question should be like, can we get there from here? And I just don't see it.
That's sad.
what we've seen over time is that the costs of healthcare have gone up, but outcomes have also improved. So if we take some measure, and the measure that I like to use is life expectancy at age 40, and then I look on the other axis at the cost of healthcare per person. And what you find is, if you look back to 1976,
all of these countries, the US, Germany, Canada, look similar in terms of what share of GDP goes to healthcare.
and they are all living, people are living about 35 years after age 40. Okay.
Fast forward 20 years, and the US is spending a lot more of its GDP on healthcare, and its life expectancy increases have not
That's
kept
a big
up
gap.
with the life expectancy increases in other countries.
So the US becomes increasingly an outlier, both in terms of outcomes, that is life expectancy, and in terms of spending.
Dang, so it's crazy. This video is very important because we just get fed like the negatives of US. Once again, it's always the negative, like, oh, the food. And of course, that plays a huge part. But obviously, America is trying to spend money to fix it. So obviously, the life expectancy has increased. So there is a positive in there. I mean, I don't see it from pockets. But if that's what the graph is showing,
then hey,
that's good, right? But our food is not getting better. That's what sucks.
And our food is the one sending us to the doctors. But it's like someone said they're doing that on purpose because if they gave you healthy stuff, you won't have to go to the doctors, and then they don't make no money. So
I believe pharmaceuticals are the biggest gangsters.
Now, you can put the two on the same graph, but that doesn't mean that they're related in any way. I think we're simplifying the other healthcare system to the point of getting it totally wrong. But a lot of it depends on who you're talking to, right? I think there's a view that some Americans have that in other systems care is terrible. You know, there's very long waiting lines and waiting lists, that the latest medical technologies are routinely not available. I think for a lot of other Americans, there's this view that other countries have just figured it out. And what we should be doing in the United States is copying what they've already figured out. And I think both those views are not right at all.
So I think people mix up this term called socialized medicine with what I would call universal health care.
One is the insurance part, that is who runs the insurance, and you can have socialized insurance where the government is running the insurance, or private insurance or private companies, or both. And then second, there's the providers of medical care, who could be either government-run employees or private employees.
there are some methods that one could classify as being socialized medicine, meaning that the government is a single payer, the government operates all the healthcare, and people belong to a single government system.
So Britain has socialized medicine because the hospitals are government institutions and the physicians and nurses are government employees.
And France has yet a different kind of a system, also not government owned. And Switzerland, Netherlands, Germany, these are places that have universal health insurance, but they have active and important private health insurance companies that administer it. So very different structures of these systems. The thing that they share in common is that they're universal.
So I think, coming full circle, my great worry with healthcare reform in America is that it has collapsed to the level of kind of fighting and arguing about these slogans. And the slogans have nothing real behind them.
These slogans have become so politically charged and tied to a particular candidate or a particular viewpoint that has become completely partisan and will shut down constructive debate.
And if you go back to what I was talking about, how do you evaluate a good healthcare system? You don't evaluate it by the share of government in the system. You evaluate it by whether patients want the care that they get and whether the care that patients get is worth it. I think that other countries have great hospitals, cover a lot of medical treatments, have fantastic doctors, and at the same time, they have not figured out a bunch of things that we have not figured out. So if you are the kind of person who's going without health insurance in the United States,
I hate to say it, but I think they are better off in many other countries than here in the US.
but for a lot of diseases, for a lot of people, regardless of income, this is probably the country where you would like to get your health care.
This was a great video.
Wow, that I would never thought they would have said that.
Yeah, this is a great video.
Also, I wonder if I don't know if this is once again like because I'm just learning, but I wonder if like everything that we have in the U.S. do they have that also in Italy and these other places that they felt had good health care, you know, like because there is some places where be like, oh well, we don't have the means to process this and tell you, so we gotta fly you out over here. So sometimes is that a good thing or a bad thing?
Like better surgeons and stuff like that.
Yeah, because
Yeah,
it's like
that would be a good question.
It's good that it covers you here, but is it gonna cover you?
I
if you
think
have to
I
get
would probably
flown
think
out?
the United States probably got the best.
Yeah, that's what I'm saying. So that healthcare wise, as far as like funds and stuff, probably not. But then when it comes to like surgeons and doctors and pediatricians, maybe I want to say I'm not sure.
I wonder how. I know they weren't on the list. Well, I don't know if they were or not because when they showed the graph. But like, I wonder how like Japan and all those places like rank, because you know like Japan and them, they normally be like light years ahead of us like when it comes to stuff.
True,
so I wonder
that's
if they like their medical like crazy out there because they be living for a long time. But they do eat
better.
great. They do.
They eat better.
They eat good. So that probably plays a huge part.
All their dishes are so much
rice,
veggies.
fish, veggies.
And I just found out, and I don't know which part, but in the Asian culture, they said that eating raw vegetables is not good. That they said at least boil it for at least 5 minutes and then eat it. They said if you notice, that's why they cook everything in the wok. And they said if you notice, like that's why all their food is cooked or steamed. Like they don't eat nothing raw. And I was like, that because the stuff that's sprayed on them, it's like that's their way of like the stuff that's I think they said like the stuff that's sprayed on them or something like that, that it's like their nature to stay alive, to be like that. So if you put a broccoli outside in the bush, it's staying alive, you know, obviously because it's connected to its like little soil and stuff like that. But if you cook it, it's taking all like that bad stuff, I guess, and it's healthier. I don't know. I seen the video. It made sense in the video, y'all. But
this is very informative. Like I said, you always get fed the negative about it, but then when you break it down on a scale, like how they did and gave you the negative and the positive, and how it made more sense. So this video is very good for us because we got fed all the negative about the U.S. and our healthcare system.
And like I said, it's not. It's always a good thing to learn something new. You know, like
I just like how they gave us both.
Yeah, that's what I'm saying. Like we're over here thinking like we got bad insurance or whatever the case is, But when you hear
I don't
it
think, but
from
I don't think it's
perspective-
bad. I think it's just America. We just affording wise. That's
Oh,
all.
yeah,
Affordability that America has made insurance now.
Yeah.
That's what it is. That I think Americans are struggling with. I don't think we've ever, well, at least us. I don't think I've ever had a problem with the actual doctors or what they offer here. I think it's just always been affordability.
Yeah, the bills, the amount. It's just like,
Like you pay for
damn.
insurance, you got to pay for the copay, you got to pay if you go to this. Like,
But then you're paying every month, so it's like, where's that? Then why am
Yeah.
I paying for? Or like, if you're paying for every month and you haven't been to the doctor once,
It's
like
crazy.
it's like, dang, that's crazy. But
But
I mean,
great video. Let us know y'all thoughts on this one. Thank y'all for tuning in. See y'all on the next one.